I'm Sergeant Hill, and this is Sergeant Levesque, and he's allowing me to conduct an eye, ears, nose, and mouth exam. Do you consent to that? Throat as well?
Yes.
Okay. So we've already conducted the Snellen chart and checked his vision for distance, and then either I'd use a newspaper or a Rosenbach chart to check his nearsighted vision. So starting with his eyes, I'm going to look at his eyebrows, and I'm going to note that his inner campus extends out to the outer campus. The hairs all present. They are symmetrical in shape. And then I'm going to move on to his eyelashes. And I'm going to look at his eyelashes and note that the upper lid is the same color with his normal skin tone. And his bottom lid is the same. Note that his eyelash hairs are extending outward, both sides bilaterally. And while I'm there, I'm going to look at his sclera. Can you look to your right? All right, checking both eyes. Can you look to your left? All right, and I'm just going to note the sclera is white and there's no red areas noted, no swelling or edema. If you could just look straight ahead. So I'm just going to look at this upper area right here for his lacrimal glands on both sides and note if there's any redness or swelling. And then I'm going to look down here in the lacrimal duct and note that there's no redness or swelling. While I'm here, I'm just going to look in his orbital eyes and just note that there's no bruising, no swelling in the adjacent areas, and there's nothing really constricting his eye movement. Check his lacrimal ducts, which are in the inner part here, and just press down. All right, and make sure that there's no regurgitation coming from his lacrimal ducts. Now I'm going to grab my otoscope, and I'm just going to shine across his eyes and check his eyes. Cornea for any apparent abrasions, and none noted. I'll switch sides. None noted. Then while I'm here, I'm just going to look at his pupils and check them for perla. So I'm going to note that his irises are a light brown, they have some green in it, and there's no shading noted. Also, they are round. And with my light, I'm going to check his right eye and watch that for constriction. I'm going to take the light away and I watch the eye constrict. He went from about 4 millimeters down to about 3. I'm going to shine in the same eye, and so that was direct, and now I'm going to check for consensual. So when I shine this eye, this one should constrict as well. And they both do that as well. I'll check this side for direct, that one constricts, and then now I'm watching this side, and they both react to the light. Now I'm just going to look at his pupils, and I'm going to ask him to look across the room. I'm going to see if his eyes react from looking across them. So could you look across the room? I watch my finger, just both eyes focus. There we go. And I note as his eyes were coming in that his pupils constricted as that occurred. So at this time I test for a corneal reflex. It's a little invasive, but I will discuss it. What I'll do is I'll take a Q-tip and gently touch his cornea, and at that time he should blink. Both eyes should blink at the same time. That's testing the eye reflex. So now I'm going to check his muscle balance in his eyes. I'll do that by standing in front of him and looking at his eyes, getting the same level as him. And all I want you to do is, with your eyes and not your head, follow the tip of my finger, okay? Mm-hmm. And while he's doing this, I'm just watching his eye movement and make sure they stay focused on the finger. I stand about 2 to 3 feet away, and we go. So his eyes are moving smoothly, following it. I'm noting there's no nystagmus while his eyes are falling. He's got smooth eye movement. Great, good job. I'm going to check his peripheral vision and make sure they're equal all around. I'm going to check superior, laterally, and inferiorly, and nasally as well. So if you could you cover one eye with your hands? All right, keeping both eyes open, and I'm going to stand in front of him, same distance. Now I'm going to wiggle my fingers. I'm going to go high roll first, and don't follow with your fingers, just look straight ahead, okay? And I'm going to get to the same level as him, just look right in my eye, okay? And I'm going to come down. Tell me when you see my hands wiggling.
I can see it.
All right. We're going to go off to the side. Tell me when you can
see it.
All right. Now we're going to see. Tell me when you
can see it.
All right, great. And then inferior.
I can see it.
Okay, great. And then we're going to switch hands with eyes. All right. Try to blink real quick so you can focus. Same thing. Tell me when you can see my fingers.
I can see it.
All right.
I can see it. I can see it.
All right.
I can see it.
Great, you have great peripheral vision. We're gonna do an inspection of his ears. So I'm just gonna look at, for symmetry, the outer canthus should be in line with the top of his auricle, which there it is. It's relatively in line. It's slightly lower, but it's not at an extreme rate. I'm gonna look at his ears, check it for blanching. There's good circulation on both sides. Note that his skin color, well, it's a little red. Do your ears feeling comfortable today?
A little hot.
You feel hot. Okay, so they're a little flushed from being hot. But otherwise, his skin is about the same color and skin tone. Alright, so I'm going to palpate the ears, and I'll do that by pulling back. Any pain or tenderness when I do that?
No.
How about this side?
No.
Now I'm going to palpate his mastoid bone behind his ear. Any pain when I touch that right there?
No.
So now I'm going to conduct a quick hearing test. I'm going to say 3 words with a whisper, okay?
Mm-hmm.
And when I say those 3 words, after I'm done, I want you to repeat those words back to me, okay?
Okay.
Cover your right ear when you do this. All right.
Blue dog square.
All right, great. We're gonna try the other side. Yeah, cover your ear.
House, car, bat.
Now, gonna take an otoscope and I'm gonna look inside your ear, okay? This should not be uncomfortable. If you have any pain or tenderness while I do that, please let me know right away, okay?
Okay.
So I'll take my otoscope, I'll pull up and back into his ear, I'll look in, I'll note that there's vellus hair, no redness, the inside looks pink, and I can visualize his tympanic membrane and it's pearl in color. Vellus hair, inner ear canal, or outer ear canal is pink. There is a little earwax, but it's nothing, it's not significant, it's normal. And then I'm gonna note that his tympanic membrane is pearl grayish in color, but it looks fine. So at this time I'm conducting another hearing test. Typically I would have a different style of tuning fork. This one's more for sensation, but I'm kind of limited as to what resources I have right now. So what I'm going to do is take this tuning fork, sound it off, and rest it on the top of your head, okay?
Mm-hmm.
Tell me if you can hear this in either ear and if the sound is equal, okay? Can you hear it in both ears? Is it equal?
Yes.
Great. I'm going to test another region. I'm going to put it behind your ear. Okay, we're only testing your left ear at this time, okay?
Mm-hmm.
So tell me when you stop hearing it, okay?
Now.
Alright. Tell me when you stop hearing it.
Now. Now. Now.
Great. Moving on to your nose. I'm just going to look at your nose directly and note that you have no redness, the same color as the rest of your skin tone as your body. There's no obvious swelling or bruising that's noted in the area. I'm just going to palpate real quick. Tell me if you feel any pain when I touch it.
No.
No pain, right? Okay. I'm going to take my otoscope again. I'm going to look inside his nose. I'm going to note that there's vellus hair and some terminal hair in there as well. I'm going to note that your mucosa is pink and your lower turbinates are pink as well, and there's no redness or swelling noted in there. If you could, with one finger, block one nostril and breathe in and out through your nose. Alright, can you switch sides for me? What I'm going to do here is I'm going to palpate the sinuses on both sides. Just let me know if there's any tenderness. And as I look at it, I don't see any swelling or anything wrong, no redness, any pain when I touch.
No.
Okay, great. Now that was a frontal sinuses. Now I'm going to palpate mastoid sinuses. Any pain when I touch there?
No.
Alright, the next test would be is I'm going to shine a light. And, oh, we gotta turn off the lights in here. Or lower them. Okay. And your sinuses, there's no blocked light and the light shines through really well. Same thing on this side. Alright, now can you open your mouth for me? Alright. Okay, sinuses look good there, no blocked light, same, alright. Alright, so I'm gonna do a mouth examination on you now, and I'm just gonna look at your lips and note that they're symmetrical, that your lips are pink and moist, there's no dry skin flaking off. You could just open your mouth like this. Alright, I'm gonna note that I can see his teeth and he has is that how they normally rest? So there is no overbite and there's a slight underbite there that his front of his teeth should go over his bottom teeth. If you could just lift up your, alright, so I'm gonna look at the gums and I'm gonna know that they're pink and moist. And, alright, can you lower your bottom lips, like look at your gums on the bottom? There you go. Alright, and his gum line's intact, there's no noted gum decay, and that his teeth are evenly spaced. I already noted that there are a few teeth missing, looks like on his lower jaw. His first and second premolar are missing, and on the left side and the back that there is a little bit of a tooth carry. Look at the top of your mouth, open your mouth nice and wide. Alright, the transverse rugae is intact. Alright, can you stick your tongue out for me? Go Alright, uvulas, midline, tonsils are in place, there's no obvious swelling or redness. His mouth is pink. Can you move your tongue to the left? Alright, no lesions noted. Alright, move it to the right. No lesions noted on this side. Gums and cheeks are pink. Can you lift up your tongue for me? His soft palate is pink. And no redness, no swelling, no lesions noted as well. That concludes our presentation. I'd like to thank you for your help and your assistance in allowing me to do this.
You're welcome.
Thank you. And thank you too as well.